Hey everyone, welcome to Easy Vet Anatomy. I'm Dr.K.P.Sharon, and in today's video I'm going to discuss about the humerus of different species. So let's get started. First we'll discuss about the humerus of cattle. Humerus of cattle, it's a long bone. It is located between the scapula and radius and ulna, forming shoulder joint above and elbow joint below. So as it is a long bone, it is having a shaft or diaphysis and two extremities. So this is the proximal extremity and this is the distal extremity. Coming to the shaft it has four surfaces. So the first surface is anterior surface. The anterior surface is wide, smooth and triangular, and it is rough and narrow in the posterior part. And just opposite to this anterior surface, we have the posterior surface. So in the posterior surface, you can appreciate foramen called as nutrient foramen. And the one more surface is medial surface. So this is the medial surface. The medial surface is nearly straight in its length, and above the middle, you can appreciate one tubercle. So in the middle of the medial surface, you can appreciate a tubercle called as teres tubercle. So this teres tubercle is for the attachment of latissimus dorsi and the teres major muscle. Lateral surface is for the brachialis muscle. The brachialis muscle, it will travel in this musculospiral groove. And it has a tuberosity here. So this is called as deltoid tuberosity. At the junction of anterior surface and the lateral surface, so they both are demarcated by or differentiated by a line called as, so this line we'll call it as a crust of humerus. So this crust of humerus, it will provide the attachment for two muscles. One is brachiocephalicus muscle and the other one is superficial pectoral muscle. And this deltoid tuberosity is for the deltoideus muscle. So just remember from where the origin of the deltoid it will takes place, both the acromion part and the scapular part. Both the parts they will get and insert into the deltoid tuberosity. And this deltoid tuberosity it is continued as a curved line. So you can appreciate this curved line and it will end at a small nodule. So this curved line is for the attachment of lateral head of the triceps, and this nodule or a small tubercle like structure, this is for the teres minor muscle. And coming to the proximal extremity of the humerus, it contains three structures. So first one is head, the second one is neck. So this part we'll call it as neck, which attaches the head with the shaft. And the third part is tuberosities. There are two tuberosities. One is lateral tuberosity and the other one is medial tuberosity. Each tuberosity is having two parts, anterior summit and posterior convexity. So this we are talking about the lateral tuberosity. Okay, and this is the medial tuberosity. Medial tuberosity is also having a summit and this is the convexity, anterior and posterior parts. And we can appreciate a groove here. So this groove is called as bicipital groove or intertuberal groove. This bicipital groove, it is bounded by the anterior summits of both the tuberosities. This is of the lateral tuberosity anterior summit and this is of medial tuberosity anterior summit. This bicipital groove in life, it is covered by a fibrocartilage for the tendon of origin of biceps brachii muscle. So just remember from where the biceps brachii muscle originates. It originates from the tuber scapulae, which is a part of a scapula, and then it will travel in the bicipital groove. Okay, and coming to the muscular attachments on these tuberosities, first we'll talk about the lateral tuberosity. So this lateral tuberosity, this is the anterior summit, it provides attachment for lateral tendon of infraspinatus, and posterior convexity, it provides attachment for medial tendon of infraspinatus. Whereas coming to this medial tuberosity, so in this medial tuberosity, this is anterior summit and this is posterior convexity. Anterior summit, it provides attachment for medial tendon of supraspinatus and deep pectoral muscle. Whereas posterior convexity, it provides attachment for a muscle called as subscapularis, the tendon of subscapularis. So subscapularis, it is originating from the subscapular fossa and it is inserting into the posterior convexity of medial tuberosity. Okay. So just to identify which is lateral and medial, so one differentiating point is you can make out the size. The lateral tuberosity is larger compared to the medial, and also you can make out a landmark. So this is the deltoid tuberosity, which is supposed to be present on the lateral side. So this should be lateral tuberosity. And if you see this tubercle, this is teres tubercle. So just above the teres tubercle, what is present? Medial tuberosity. Anterior summit and posterior convexity. Between these two anterior summits, you can appreciate a bicipital groove, and this the tendon of biceps brachii will pass. Next, about the distal extremity. So the distal extremity, it has an oblique surface which is divided by a ridge into two condyles. So you can appreciate this ridge. So it is divided by a ridge into two condyles. The one which is larger, this is the medial condyle, and the one which is smaller, so this part is the lateral condyle. So the medial condyle, it is crossed by a groove. Groove is nothing but a depression. So it is crossed by a groove which extends into the olecranon fossa. So this fossa is the olecranon fossa. So this groove which is present on the medial condyle, it extends into the olecranon fossa and articulates with the semilunar notch of the ulna. So we'll discuss about the radius and ulna in the next video. You just remember, so this groove on the medial condyle, it extends into the olecranon fossa and articulates with semilunar notch of the ulna. Okay. So this distal extremity, it has a fossa. So this fossa which is articular. So this fossa is called as coronoid fossa. So this coronoid fossa, it receives a process of the radius, that is called as coronoid process. And on the posterior side, you can appreciate one more fossa here. So this fossa is called as olecranon fossa. Olecranon fossa, it receives anconeus process of the ulna. Ulna proximal extremity, it contains a process called as anconeus process, and that will fit into this olecranon fossa. During extension and flexion, so these coronoid and olecranon fossa, they receives coronoid process and the anconeus process respectively. So these condyles are for the articulation with the proximal facets which are present on the proximal extremity of the radius. So there you can appreciate a large facet for the medial condyle and a small facet for the lateral condyle. So condyles are nothing but they are the cylindrical articular areas. So behind and above the condyles, there are two thick raised structures. So these are called as epicondyles. The medial epicondyle and the lateral epicondyle. So this is medial and this is lateral. So medial epicondyle is somewhat prominent. Okay, and this medial epicondyle, it furnishes the origin to flexor group of muscles of carpus and the digits, and it also bears a tubercle here. So this tubercle, it is for the medial ligament of elbow joint. And the lateral epicondyle, so this is the lateral epicondyle, so it bears a crust. So you can appreciate a crust here. So this crust is called as condyloid crust. It is in a form of a raised ridge which gives the origin to a muscle called as extensor carpi radialis. Okay. So between these two epicondyles, you can appreciate a fossa called as olecranon fossa, so which receives the anconeus process of ulna during extreme extension. And the distal extremity, it also presents a rough depression laterally and a tubercle medially. So medially you can appreciate a tubercle and laterally you can appreciate a depression. So these two are for the collateral ligaments of elbow joint. So this is about the humerus of oxus species. Next we'll discuss about the humerus of horse species. So the humerus of horse is comparatively somewhat massive, and here the differentiating point is, so this tuberosity, deltoid tuberosity is more prominent compared to that of ox. See here, this is the deltoid tuberosity of ox. Here it is more prominent. Okay, and the bicipital groove is divided. So this is the bicipital groove. So you can compare with the with the ox. So this is the bicipital groove in case of cattle, whereas here the bicipital groove is divided by an intermediate ridge. So this is an intermediate ridge which looks like a tuberosity. Okay. And one more thing, you just remember here the summit of the lateral tuberosity, it overhangs the bicipital groove in case of cattle. This is the anterior summit of lateral tuberosity. the summit of the lateral tuberosity, it overhangs the bicipital groove. Whereas the summit of the lateral tuberosity here, it will not overhang the bicipital groove. So this part is the lateral tuberosity. This is anterior summit and this is posterior convexity. See here you can appreciate the deltoid tuberosity. So this is the lateral side, anterior summit and posterior convexity. And this is the medial tuberosity. In the medial tuberosity, this is anterior summit and this is posterior convexity. This is just an intermediate ridge, okay, so which divides this bicipital groove. This is not a tuberosity. This is an intermediate ridge, but it looks like a tuberosity, okay. And the coronoid and the olecranon fossa, they are comparatively shallow, okay. This is olecranon and this is coronoid fossa. And next we'll discuss about the humerus of dog. Here the musculospiral groove is shallow. So this is the musculospiral groove, it is shallow. And the deltoid tuberosity, so whatever you are seeing here, this is the deltoid tuberosity. It is in the form of a low ridge. It is not that much prominent as in ox and horse. And the lateral tuberosity, it is undivided. The lateral tuberosity is undivided. And one more differentiating point is, so this is coronoid fossa and this is olecranon fossa. They both are communicated through a foramen called as supratrochlear foramen. So this foramen, it will not provide any space for the passage of any structures, but these two fossa, they were connected or communicated by a foramen called as supratrochlear foramen. Next we'll discuss about the humerus of the fowl. The humerus of the fowl, it is, the body is flattened. So as it is flattened, it is having two surfaces. So this surface is cranial surface and this surface is caudal surface, okay. And it contains a head, ellipsoidal head, so which forms the shoulder joint. So this head, it articulates with the glenoid fossa, which is formed by the scapula and the coracoid. On the cranial surface, just distal to the head, so here you can appreciate a groove. So this groove is called as a transverse groove. So this transverse groove is for the acrocoracohumeral ligament. And in the proximal extremity, you can appreciate two tubercles. So the smaller one, this is the dorsal tubercle, and this dorsal tubercle, it continues as a crest. So this crest is called as deltopectoral crest. And there is a larger ventral tubercle. So this is ventral tubercle. So this ventral tubercle, it merges with the crest called as bicipital crest. So this is dorsal tubercle and this is deltopectoral crest. And this is ventral tubercle, which is continuing or merging with the bicipital crest. Between these tubercles, there is a space. So that space, we'll call it as intertubercular plane, okay. Just adjacent to the ventral tubercle, this is the ventral tubercle on the caudal surface. Here you can appreciate a deep recess. So this one, this recess is called as pneumotricipital fossa. So this fossa, it presents a foramen called as pneumatic foramen, okay. This is about the proximal extremity. And distally, it will contain a barrel shaped condyles, okay. So these are condyles. The one which is present towards the dorsal side, it is the dorsal condyle, which is somewhat larger, and this is the ventral condyle. So just posterior to that, you can appreciate the epicondyles. So these epicondyles are for the muscular attachments. So opposite to the dorsal condyle, you can appreciate dorsal epicondyle, and this is medial epicondyle. Hope this video helped you. So do follow, like, share and subscribe to Easy Vet Anatomy. Thank you.